Hi, I'm Deanne Birch, Programme Lead for the Hep C Later team. In today's podcast, we're speaking to Aneesha Noonan, National Primary Care Lead for Hepatitis C Elimination at NHS England. Welcome, Aneesha. Thank you for joining us.
Thanks for having me, Deanna.
So, Aneesha, as the National Primary Care Lead for Hep C Elimination, could you tell us a little bit more about your role, who you work with as part of that national programme?
Yeah, of course. So, as you probably know, the Hepatitis C Elimination Programme has already had really great successes in finding and treating 80,000 people for hepatitis C so far. Those people have mainly been in secondary care and specialist healthcare settings. So, that's like prisons and drug and alcohol services. My role is really to facilitate the expansion of that programme into primary care settings where we haven't traditionally had targeted hepatitis C case finding. So to do this, I work with a range of stakeholders. That includes the ODNs, the operational delivery networks who deliver the care for hepatitis C elimination across the country. Their local GPs and GP champions for hepatitis C elimination, as well as UKHSA and the pharmaceutical companies and IT providers who have developed the tools to support case finding. And we're also increasingly working with the ICB leads who can help us support the reach across primary care. And that's just the ones I can think of. There's definitely anybody who's doing something with primary care is potentially somebody we can work with.
Excellent. So, why are NHS England now focusing on patients across primary care in particular?
So we know we've made great progress in finding those people who have current risk factors for hepatitis C in those specialist services I mentioned. But UKHSA have estimated that over 60% of those left to find who have hepatitis C, so that's around 40,000 people, are likely to have a historic risk factor. So that's things like a past history of injecting drugs. And those people aren't really likely to be in contact with specialist services such as drug treatment centres. And they quite likely don't consider themselves at risk either. It might be something that they did 20 years ago, 30 years ago, that's really saying nothing to them about their lives anymore, and they've forgotten about it. And the other cohort of patients are those born abroad in countries with high prevalence, such as Egypt, Pakistan, and Eastern European countries. Again, the majority of those patients aren't going to be accessing care in specialist services. So we need to look for them in more general healthcare settings. That's primary care, community pharmacy, and emergency departments, where we've now got an opt-out testing program rolling out as well.
Excellent. So, what are the key challenges then in reaching professionals and the community of primary care?
Yeah, so primary care is definitely in a great position to find those 40,000 people, but we're absolutely facing some challenges. Primary care has never been busier in terms of workload. We've got a reduced workforce, certainly in general practice, but across the community healthcare settings. And we've got increased patient numbers who have greater healthcare needs post-pandemic. Also, because hepatitis C elimination has been traditionally managed in those specialist settings, awareness of hepatitis C and especially the elimination program and what it's doing, it's really low in primary care. And that's just because it hasn't been the workload. So really, we're aiming to increase awareness and engage with primary care colleagues, but at the same time, we're trying to support them to find those people with hepatitis C, but not add significantly to the workload that they're already facing.
So lots of challenges, but equally lots of solutions,
A lot
hopefully.
of opportunities.
So what are the benefits then to both primary care practitioners, the NHS and the general public of reaching Hep C elimination across England?
Yeah, well, quite simply, the NHS England Hep C elimination programme saves lives, Diana. Of the 80,000 people we treated for Hep C, we prevented multiple deaths and long-term ill health from liver disease and cancer. We've dramatically reduced the number of transplants required as well. And these are fantastic achievements for our patient population. And that's first and foremost the most important thing. But this also saves the NHS money in the longer term. We're avoiding disease and the costly interventions that come with treating those diseases. If we're keeping people healthier for longer, we'll always benefit society as a whole as well. And we know that with hepatitis C elimination, we're reaching some of the most disadvantaged people in our communities. Almost half of Hep C treatment are given to the most deprived 20% of the population, which demonstrates how the elimination programme is also making critical strides in tackling health inequalities as well. And if we think about that population, And we think of hepatitis C as a proxy for other long-term conditions and other population health management we want to do in terms of general practice and our patient population. It's an opportunity to engage with people who might not otherwise be accessing care for their wider general health. So we're eliminating a cancer-causing illness, and we're also at a point where we've got an opportunity to see those patients improve their lives generally.
It's fabulous work. What a legacy. So how can GPs in particular become more actively involved in the national programme? Perhaps you can tell us a little bit about some of the projects currently underway.
Yeah, absolutely. I mean, we'd love more GPs to be actively involved in the programme. There's 62 million people registered with a GP across England. So that's 62 million patient records that are available to review in terms of their historic risk and finding those people who don't know that they're at risk. We have a fantastic patient search tool that's already available on every GP IT system in England. It can run a search across a GP set of records and produce a list of patients who are coded as having Hep C or have a risk factor for Hep C, and it produces that list of patients in a matter of minutes. We've got a growing network of GP champions who are recruited to work with our operational delivery networks and those GP practices to run the tool and then support management of those patient lists. So those GPs running the list don't have to deal with all of that themselves. We'll help to do that. As well as that, our GP champions are out there raising awareness and engaging with our GP colleagues through educational sessions and spreading the word, either through GP practices who are already up and running and doing that, but also getting out to our GP trainees. And we're also doing some targeted work with particular communities who are at higher risk. So an example is our Bristol GP champion is starting to do some targeted work with patients from Eastern European countries in primary care and trying to get increased testing. And we're doing that really simply through spreading information to those GP practices, engaging those patients in languages that they speak at home, and signposting them to our self-testing portal. So anyone in England over the age of 18 can get a free hepatitis C test by visiting hepctest.nhs.uk. And that's available to anyone at any time, but we're also promoting that through general practice and our champions. Apart from that, there's some projects going on with GPs facilitating prescribing of medication and access to medication for patients who otherwise would struggle to get it. We've also got a dashboard that we're developing that's finding the practices with really high numbers of codes for risk of Hep C, so we can do some targeted focus work where it's really needed to be done. GPs themselves, they can access some free educational resources. I know there's absolutely tons on Hep C later, and there's also a module on the RCGP. And we're here as a national team. Now that I'm in post, any GP wanting to learn more, get in touch, run the search and be facilitated to eliminate their patient population, they just need to get in touch and we'll help them do that.
So just like you said, Aneesha, there's multiple resources available on hepclater.com if you're listening and you want to be more involved in eliminating Hep C in England. So some of those resources are specifically aimed at professionals and patients within primary care. So things like there's a primary care toolkit, CPD accredited training, posters, leaflets, TV screen graphics, as well as loads of other free materials that are available for people to use. So, Aneesha, what has been the most rewarding part of being involved in the Hep C elimination programme for you?
There's so many rewarding parts. It's really actually quite difficult to say. I've absolutely loved joining this team and this programme. It's so fantastic to be part of a programme that has cured 80,000 people of their risk of liver cancer. We've reduced deaths from hepatitis C by 35%. We've seen a 52% decrease in liver transplants for Hep C. That's enormous in itself. That's still not my most impressive thing. I'm absolutely blown away by our GP champions and their commitment and passion for the work and the way they've taken up the challenge, and they're spreading awareness and engaging so many of our GP colleagues who are then in turn really engaged to be part of something so amazing. But I think the most rewarding part for me has been hearing about the cases where we found and cured people who had no idea they were at risk. That's why we're doing this work, and it's fabulous when it succeeds in changing someone's life for the better.
Excellent. And finally, Aneesha, if there was one piece of advice you could give to help those in primary care start eliminating Hep C, what would it be?
Run the search tool, get in touch with your local operational delivery network. We'll help you do all of that.
Thank you so much for joining us today, Aneesha, and for all the work that you're doing to help eliminate Hep C. And thank you to everyone who's listened to our podcast today. If you'd like to know a little bit more about how you can get involved, email us at connect.hepclater@mpft.nhs.uk.